Okay, so today we have one of my patients, Resh, and he's come back now 3 months after his acne scarring treatment. And he came to see me back probably total about 4 or 5 months ago, didn't you? You had quite a lot of scarring from previous acne as a youngster, and essentially that had caused a little bit of fixed scarring and tethering. And then it also caused scarring in the skin, hadn't it? Yeah. So we decided that we were going to proceed and release the scarring with a Taylor Liberator for you, didn't we?
Yeah.
And then about a month after that, the full ablation.
Yeah.
So tell me a little bit about the journey so far.
Yeah, so always sort of struggled with my skin a little bit. Had a few years in my 20s where I just got quite bad cystic acne. Never went on Accutane. And then when all the spots cleared up, I was left with some scarring. So mainly box scarring and isolate scarring. So you actually did some incisions as well?
Yes.
As well as the Taylor Liberator.
Incisions,
Yeah,
I
yeah.
remember that.
So I had like the full gamut.
The full Monty,
yeah,
exactly.
the full thing.
This is a mixed scar.
Absolutely, yeah. So the Taylor Liberator went really well. I think within a couple of days I was feeling back to normal. And I noticed probably about 20-30% improvement with that one.
To the tethering,
Just the tethering,
elements of the tethering.
Exactly,
that is there.
exactly. When the stitches came out, I could see that the skin was a bit smoother at that point, and then sort of being lifted up. And then I was obviously a bit more nervous for the full ablation because it was I guess a more intense procedure. But you helped me, talk me through that. The guy at the staff were great.
So obviously, being skin type like mine,
yeah,
our skin types always worrying about
Yeah.
things like hyperpigmentation and things like that.
Yeah.
Will my pigmentation ever come to normal?
Yeah.
When you were back at work, I know you were a bit high, you obviously got some hyperpigmentation. This is normal for our skin types.
Yeah.
But I mean, it was livable.
Yeah, I mean, to be honest with you, it was more the redness, I think, that was a bit more, took a while to settle. But I was back at work within a couple of weeks. And I would say using Vaseline and Aquaphor was probably the harder bit, almost, than the redness. Yeah, because you just looked a bit sweaty and greasy all the time. But that, honestly, was probably the hardest bit for the first 4 weeks, I'd say. And then moving on from there, it just seemed to get better every week, really. And I'd say probably by week 9, week 10, things are really improving.
So with what we've done now, essentially, you know, it is quite a heavy sort of procedure, effectively. Is it something, you know, typically people will come to me after having done multiple microneedling, fractional laser, radio frequency microneedling, and then we're kind of, as you know, at the end of the road.
Yeah.
So essentially, it is a lot to go through. But for the degree of improvement you've got, what are your thoughts on, was it worth the journey?
Yeah, definitely. I think people who've got acne scarring always notice it first when they look in the mirror. So it's, and I think you kind of helped me approach it from a different angle, which is not cosmetic, more reconstructive, because you've got a scar. So it's treating the scar patterns.
And acne is obviously not something you volunteer for.
No,
it's
exactly.
things that people get, and then it leaves you with scarring. It's not just, you know, you're making your nose bigger or smaller or whatever.
Yeah. And I think being a doctor as well, I feel like as a youngster when I had it, I was probably shortchanged a bit from seeing GPs who just maybe dismissed it a little bit. You know, I probably was on Doxy for a little bit of time and Adapalene, and none of it really helped. And then I went on Accutane. I actually had TCA Cross, a few sessions of that, which made a bit of a difference. But I think reflecting back on what I've done, I'm glad I went the full hog and got it all done. Obviously the recovery was intense. I'd say for the first 4 weeks was pretty full on, and you've got to be really careful with your skin and just how you wash it and clean it and look after yourself. And you know, I deliberately did it in the winter time as well.
Just to make sure it's darker outside.
Yeah, just at home a bit more, and I didn't put too much in the diary. But I think looking back now, I'd say that in some lights, I wouldn't even notice I have much scarring actually. It's hard to put a percentage on it, but it's definitely more than 50-60% improved, I would say, for me. And like I said, in some lights, I don't even notice it at all. So yeah, I'm really happy I've done it actually.
So you had